The focus on adolescents will always be crucial to Australia, as the influence that the systems have on them will influence their decisions and lifestyle, which is essentially Australia's future. The schools, jobs, homes, hospitals and environments they are exposed to shape their personality and values, which will be emphasised in their adult life, making adolescent studies imperative to Australia's socio-economic position and welfare. In this presentation, we will discuss and identify the social determinants, risk factors and impacts surrounding adolescence and how primary healthcare should aim to help. This is Tom Sheridan. He is 16 years old and lives in Sydney's southwest with his mother and older siblings. His father passed away due to a heroin overdose and left the family with little remaining money. He attends a public school in a poor socioeconomic suburb, and his friends are experimenting with drugs and taking risks. The social determinants of health are the factors that make a person who they are: where they work, gender, religion, ethnicity, age, where they were born, and more, which is why assessing these in terms of risk factoring in adolescents is vital to their social and health development. Especially in this case, the network, socioeconomics, culture, environmental, and health systems an individual is surrounded with has an impact on their choices and values. We will be exploring the social determinants of health, of education, literacy, and social environments relevant to adolescent development. The social environment we're exposed to as individuals impacts our views, behaviours, and decisions throughout our lives. In earlier years, it is a formative environment, as teenagers are susceptible to psychological change and inherit their views and behaviours from the indicators around them. As teacher Stacey Keeger has concluded, 70% of teenagers begin smoking between ages 12 to 17 because their friends did. The social belief of what improves your social status is detrimental to Australia's adolescent population. Tom attends a poor socioeconomic public school in one of the biggest cities in the world and is introduced to many things before the rest of Australia. The influence of his older siblings and peers is heavily involved in their decision and risk-taking behaviours. Educational literacy is vastly different across Australia because of the many demographics, amount of resources, and technological advancements schools might have or could lack. While children in primary and secondary schooling are entering the most constructive years of their life and having limited resources and education outlets, this lowers their potential immensely. The lack of these opportunities can lead to academic, financial, and personal burdens, as Professor Ken highlights. Those with poor literacy earn on average 30 to 42% less than those who are literate. Those exposed to lower literacy opportunities do not have the advantage of a well-paying job, leading to poor housing, therefore poorer health. It is a horrible cycle Tom is susceptible to: poor community, single-income household, poor education levels, and the risks that could worsen or evolve from his situation. Unhealthy lifestyles can be a risk factor of educational literacy, but also long-term impacts of this social determinant. Tom is a teenage boy and should be exercising at least 60 minutes a day, as well as meeting all of those food groups for his bodily development. Lower income and lack of nutritional knowledge impact his ability to do so. Therefore, his immunity is weakened against many illnesses, not to mention the side effects of substance abuse worsens any health issues. In addition to these initial barriers, COVID-19 has shifted the focus of giving your body what it needs to avoiding what it doesn't. With the mandatory isolations through 2020 to 2022, gyms have been locked down and school sports have been cancelled, lessening the opportunity for kids to exercise daily. The decrease of food productivity with economical interruptions, teenagers growing up in 2022 are faced with many external factors that impact their ability to overcome. In these formative years, it is an unstable foundation to build their nutritional and health knowledge from, meaning in the future their health can decline. Without the full development and nutrition whilst their bodies are still growing, and it can lead to obesity, osteoporosis, and hyperlipidemia, potentially life-threatening diseases. Tom's social environment is poor and unstable. The influence of family and peers, as well as the external social media, can impact Tom's decisions vastly. The teenage years are well known for experimenting. As Better Health Victoria has researched, 16% of teenagers 12 to 17 have tried cannabis, and 37% of Australian teens drink before their graduation. There are a number of reasons they link the use of illegal substances. For example, socially, dealing with past trauma, and trying to escape from mental or physical pain. Applying this to our case study, Tom, he comes from a demographic of teenagers and has grown up from traumatic events. Again mentioning he is a teenager influenced by his peers and possibly his older siblings in unison. National Centre for Biotechnology Information, Alonzo White, has also researched drug abuse amongst adolescents. His study of the long-term impacts concluded drug exposure is also associated with long-term effects on learning and memory and executive functions, which in the teen years is detrimental to the rest of their lives. Loss of brain cells, brain function, memory loss, and cognitive impairment, as well as risks of illicit overdose, experimental drugs are dangerous and unfortunately common amongst teens. Primary care nurses are the face of the healthcare system in Australia, as they are in general practice, hospitals, aged care, and schools. They have the responsibility of providing proactive healthcare, promoting health, providing education, and problem solving. The World Health Organization emphasizes the Global Commission's drive to advocate for the social determinants of health and highlights what primary healthcare nurses should be doing. Expanding the knowledge base, developing a workforce that is trained in the social determinants of health, and raising public awareness about these social determinants. Which is why, in Tom's case, providing him with the best educational resources to prevent and avoid health implications is the responsibility of his nurses. Educating him about living a healthy lifestyle, undertaking a healthy diet, and encouraging exercise, in addition to providing him the correct information about drugs, tobacco, and alcohol, are likely to lessen, if not remove, the use of them. With Tom's social circumstance, nurses are able to provide with proactive care, ensuring equality is maintained regardless of his background. As nurses are trained, this is the correct, ethical, and respectful approach. Despite of nurses' personal views of certain lifestyles, we have been trained to treat each person respectfully, regardless of individually defining characteristics. The social determinants of health in relation to social environments and educational literacy impacts not only our case study Tom, but all Australian teenagers to one degree or another. Primary healthcare nurses are trained to overcome unhealthy lifestyle habits, substance abuse, income limitations, religious or language barriers, and communicate with their patients and team about a beneficial and successful care plan. Tom will benefit from the advice and education from the primary nurses, as well as many other teenagers, and improve their physical and mental well-being. Providing this safe space, Tom can overcome the potential of obesity, osteoporosis, lipidemia, substance addiction, and overdose, just to name a few, which will benefit his future livelihood thanks to primary healthcare nurses.